Okay, so we thought we'd just run through a little video with you of how to keep your braces really clean, the lingual braces in particular, because they can be a little bit more fiddly to keep clean. So we thought we'd just run through the instructions again with you on a video so you can look back whenever you want to. When you get up in the morning, eat your breakfast. After breakfast, then brush your teeth. That way you're only going to have to be doing it once. So you can use either a manual toothbrush, we do recommend one like this that's double-ended, or you can use an electric toothbrush. We do recommend the Oral-B one because they do the specific orthodontic heads, and you'll get 2 heads in the kit, a round one and a little tufted one. Whichever one you use, it's the same principle. So obviously with the braces on the inside, you can go around and brush the outside of your teeth like you would normally, the biting surfaces, and then you need to focus on the inside. So with the toothbrush, it's small circular movements, making sure that you cover all the surfaces and include the gum on the inside. You go round. If you're using the electric toothbrush, it's exactly the same, letting the electric toothbrush do the work, making sure that you're just angling it into all the areas, but especially the gums. You'd use it in your normal way on the outside. Again, just letting the brush do the work. We would recommend that you have a travel toothbrush with you, so that during the day, whenever you've had your lunch or if you're having a snack, then you can just give your teeth a quick brush, just to make sure that you haven't got any food particles caught under your brace. Some people do find it handy to have the TP brushes with them as well, because on the inside of with the braces on the inside of the teeth, it is a little bit more tricky, and quite a lot of people do find that the TP brushes are actually easier. So you can keep a packet of TP brushes with you that you can use during the day. As with braces on the outside, it's at night time when we recommend that you do slightly longer clean. There's a few more extra stages to it. So again, first of all, give your teeth a good brush with whichever brush that you're using. Again, making sure that you're doing the outside, the biting surfaces and the inside. We do recommend that you use disclosing tablets. So you just need half a tablet, pop it in your mouth, chew it up, crush it up, and push it all the way around your teeth. Rinse that into the sink, keep rinsing until the water coming out is almost clear. And then try and have a look. It is a little bit more tricky with the lingual brace. You almost feel like you have to stand on your head. Maybe use a smaller mirror so that you can see inside the teeth. Anywhere where there's a purple or pink colour left means that you've left behind some plaque or some food debris. So again, you need to go back in and brush it. And again, using the little end of the toothbrush is really, really useful, just the tufted end. It's really useful to get into any spaces there. If you're using the electric toothbrush, I'd recommend that you pop the tufted end on for that piece, anywhere around there. The disclosing tablets do make your tongue pink or purple, that's why we say just do it at night. Hopefully by the morning that will have gone. They can stain your lips as well, so maybe pop a little bit of Vaseline or lip balm on before you use them. That way you shouldn't end up with bright pink or purple lips. We do also recommend that you use the TP brushes. So we recommend 2. The pink one is thinner, blue one is thicker. The pink one is designed to replace flossing, so it just goes in between the teeth, give it a wiggle, pull it out, move around to the next one. If it won't go through a space, don't force it because you'll make your gums quite sore. Just move on to the next one that it will go through. As your treatment progresses, you'll find it will go through different spaces. The blue one is designed for keeping around your brace clean. You just pop it between the wire and the brackets and give it a wiggle around. You go around all the spaces, around the top and the bottom. These brushes are reusable, you don't throw them away after the first use. You can give them a rinse, pop the cover on. You'll probably get about 10 days, 2 weeks out of each brush. They start looking a bit threadbare and get a bit wobbly when they need changing. As with the braces on the outside, with the lingual braces we still recommend that you use this mouth rinse. Half a capful, lasting at night. Good swish round for 30 seconds, spit out any excess and then go straight to bed. Nothing to eat or drink after this, and then you're getting the maximum benefit and effects from using it.